Hello, I'm Dr. Brook, a board-certified veterinary dentist in both the American and European veterinary dental colleges, as well as a fellow of the Academy of Veterinary Dentistry. This lecture is entitled Current Concepts of Periodontal Disease and subtitled Not All Plaque is Created Equal. This is an important point as we will talk about the difference between the plaque you can see and the plaque you can't. And it's current concepts because I like giving this lecture for a couple reasons. Number one, periodontal disease is probably the most misunderstood disease out there in dogs and cats, period. Most of what we were taught, if we were taught anything, is wrong. It's based on a misconception that I aim to cure tonight. Another reason that I really like to talk about gum disease in dogs and cats, it is by far the number one disease in dogs and cats. I mean, number two is not even close. The classic studies that we talked about years and years ago from the 80s was that 70% of cats and 80% of dogs at 3 years of age had some degree of gum disease. That's amazing. 80% of your patients have gum disease? What else is near that high? Not even overweight is that high. But the sad truth is that underestimates the true incidence of this disease, as we'll talk about. And finally, why do I really like to talk about this disease process? Because it's killing your pets every single day. A little bit, not a lot, but a little bit. Now, not all veterinary dentists believe that. I do. That's Brook's opinion, is that this is a killer. And oh, by the way, on the human side, they call periodontal disease the silent killer. Why? Because it has minimal to no clinical signs, but it does cause massive damage. Well, again, in Brook's opinion, as we'll talk about. So, without further ado, let's talk about gum disease. I do have to say that I own quite a few practices and different other dental-related services. I do speak for many companies, Beerback, BI, Hills, Covetris, all the different stuff, and I have written books. So bottom line is that I do work for a lot of companies, and we're going to talk about some of their products in this lecture and the next. I have no financial interest in anybody that I speak for. I speak for them because I like their products, not because they paid me to. But I do own a lot of stuff. So, but bottom line is nothing is, there's no true conflict of interest out there. Speaking of books, if you're really into vet periodontology and you want to know more about it, most of the pictures from this book or from this lecture are in this book, Veterinary Periodontology. When I talk to people, I say, I know so much about this, and so much of this lecture was based on the research that I did to write this book. The things that I learned as a boarded dentist was like amazing. And a couple other ones. Dog Beach Vet is my website. Any of this information is on there if you want to pick up some of these books. All right. These are normal gingival tissues. They're coral pink in color. There's no plaque. There's no calculus. There's no redness. This is what you want your animal's mouth to look like. This is what your mouth to look like. The problem is it took me 2 years to find this dog to put him in this lecture. Why? Because he doesn't exist in nature. He doesn't. Okay? We've got to get to this level of care and keep our animals healthy. This is a normal dental radiograph. Okay, the bone fills up the area between the roots, comes up to the neck of the teeth right here. This is normal. Okay, we see this more often than we see no inflammation, but we don't see it quite often in nut. And I put this in here just so you guys can see what it looks like when you start getting bone loss. Okay, most important slide of the first part of this lecture. What is the cause of gum disease? Plaque. Plaque is what causes gum disease, just like, well, COVID causes COVID. Parvo causes, parvovirus causes parvo. This is the etiologic agent. If you have no plaque, you have no disease. Okay? So we're going to talk about other reasons why some animals get it and some don't. But the bottom line is if you have no plaque, you have no disease. So what is plaque? Plaque's a biofilm. What's a biofilm? A biofilm is a layer of bacteria on a surface, and they can be anywhere. They're on the desk you're sitting in front of. They're on your computer screen. They're on the cup you're drinking out of. They're on your arms. Okay, Staph aureus is a normal biofilm, so they're everywhere. But when they're allowed to build up, that's when they become pathogenic. 300 million bacteria per gram. They ultracentrifuge plaque to get more bacteria into it. They couldn't. It's all bacteria. Eventually, it gets calcified by the minerals in saliva to become calculus or tartar. What's that? Calcified bacteria. But here's the important point. Plaque forms on teeth in 24 hours. Tartar starts in 3 days, and gingivitis in just 2 weeks. Oh, by the way, pockets are the same death in 6 weeks. Do you want to know why all dogs have gum disease? It's because we don't do home care. That's why. And we need to start doing more of that. We'll talk about that in the periodontal therapy lecture. All right. Here's another thing. And here's the sad truth. This information was known about in the 1700s. The guy that invented the microscope knew that plaque in a biofilm were more resistant to antiseptics than singular bacteria. Leeuwenhoek, or whoever developed the microscope. The bacteria, once it enters into a plaque biofilm, becomes significantly more resistant to antiseptics and antibiotics. Oh, by the way, 1,000 times more resistant to antibiotics. Oh, great. We want to treat this periodontal disease with antibiotics. 1,000 times more than you would to treat a skin infection, say. You're going to kill the animal before you kill the disease. Oh, by the way, I want to use this rinse or water out of or whatever. 500,000 times more than would kill a singular bacteria. Mechanical removal is the key. Now, some of the things we'll talk about, the antiseptics, do work, but much better in combination with mechanical removal, i.e. brushing or properly designed chew treats, as we'll talk about in periotherapy. One thing that is huge on the human side, huge, is smooth tooth surfaces. When I was researching the veterinary periodontology book, and I was looking at the human research and the human books, in the human periodontology books, there were chapters donated to restorative dentistry. Why? Because if you don't have smooth teeth, you're going to get gum disease. End of story. They're never going to do any periodontal work unless you have a good crown or good restorative margins. You've got to have smooth teeth. Anything that's going to roughen a tooth surface is going to increase plaque and calculus attachment. And I explain it like, if you threw oatmeal against a mirror, it would slide right off. But if you had a textured surface, it would attach to it much faster. So the common things are either enamel hypocalcification or crown fractures. So here's an example. Here's an uncomplicated crown fracture. Okay, little small fracture here you can see here, but huge amounts of plaque and calculus attaching to it because it's a rough tooth surface compared to the teeth on either side. And this tooth is already getting gingivitis. So that's why one of the reasons that I'm a huge believer in doing a procedure called a bonded sealant on any of these uncomplicated crown fractures. Okay, and it's dirt cheap to get into, works really well, smooths out these teeth, gets rid of the pain, blocks out the pathway for sensitivity. And then here's a 10-month-old dog with widespread enamel hypocalcification. Look at how bad his teeth are already. He's going to have horrible gum disease. So part of periodontal therapy, you're talking about complete periodontal therapy, is smoothing out the tooth surface. So that's restorative dentistry, and bonded sealants are, like I said, $600 to get into doing, as long as you have X-rated drill system. You can learn it, and oh, by the way, doctors, you can learn how to do composite restorations as well. We teach them on our level 2 day, that's usually in March. You can learn it out of the restorative book as well, because you take something that looks like this. Again, 11-month-old dog, horrible gum disease, horrible thing. Every one of these teeth is sensitive. They all hurt. You make it look like that. It's great for Facebook. It makes the dog feel better, smooths out the tooth, decreases gum disease, and hypocalcification when you have it on a couple teeth, especially big defects like that, we put on composite restoration. Again, if you guys want more information, just pop onto dogbeachvet.com under the information for veterinarians. It's all right there. Another thing that's going to increase plaque adherence is crowding is the big one. Once you get pockets, it get worse when you get gingival enlargement or foreign bodies, but the big thing is crowding, especially in brachiocephalic breeds. When you have these teeth crammed together like this is a young dog. You can see it's here for this fractured upper fourth. He's about 3 years old. He's got a 10-millimeter pocket between these teeth. Because they're crammed together, they don't have a natural cleaning ability, especially when this third premolar, that distal root of that third premolar, gets trapped between the mesial roots of this upper fourth. You're going to lose this upper fourth. Selectively extract some of these teeth. It's going to make a big difference. So, supragingival plaque is the initial plaque formed above the gum line. So this is what you can see above the tooth, okay, above the gum. Once it gets into calculus, it's going to get thick and nasty. But here's the critical point. Everything that you can see on the surface of the tooth does nothing. So I don't put this slide in here to gross you out. I don't put it in here to show you the hair, the pus. I don't put it in here to remind you that that's about 10 trillion bacteria on these dogs' teeth. I don't put this in here to tell you this is so bad there's mold growing underneath the calculus. The reason I put this slide in here is to tell you that all of this, everything that you can see, does nothing to your patient. And this little friend over here. I put these things together with an artist. These are what we call periodontal, and they help you to drive home the key points. Not all plaque is bad. It's the stuff up underneath the gum that causes the problem. Once the bacteria makes its way under the gum line, it's protected from oxygen. That allows the anaerobic bacteria to flourish, and it's the anaerobic bacteria that create the inflammation, create the halitosis that we see, the bad breath, and that is what the body reacts to and causes bone loss. So it's subgingival. So here's the critical point. Until you are cleaning below the gum, at and below the gum line, you're not doing anything medical. Now, yes, do you have to clean off the surface of the teeth? Of course you do. You must get rid of this area here because, again, it's a rough tooth surface. But they did a study on the human side. They cleaned the surface of these teeth, okay, all the way down to the gum line, left everything at and below the gum, 0 resolution of disease. Vice versa, they came in and cleaned everything up underneath the gum, left the surface of the teeth, left the crowns looking like this, 100% resolution of disease. This does nothing other than it does increase the roughness, so it's going to worsen gum disease. So it has to be cleaned, but you've got to clean it up underneath the gum. So why do some animals get gum disease and some dogs not? Okay, why do greyhounds get it? Why do little dogs get it? It's a genetic predisposition. And we'll talk about this more in a minute. But the bacteria create the inflammation. It's the body's response to the inflammation that determines the progression of disease. So if the animal has a good response to it, it just keeps its gingivitis. If it doesn't, then periodontal disease occurs and you get bone loss. So another critical thing that you're all taught, lift the lip, look for tartar. Lift the lip, look for tartar. Wrong. I mean, yes, it's a sign that you need to clean the teeth. And yes, it's a sign that there's gum disease, but it's not the cause, okay? It's caused by plaque. So just because you have a bunch of tartar does not mean that you have bad gum disease. So you take a look at this dog. Do you see much tartar there on any of these teeth? Look at how much inflammation he has. This dog is reacting to just a little bit of plaque. This dog's got horrific gum disease, but almost no tartar. Vice versa, you look at this cat. He's got a huge iceberg of tartar running down his cheek. You physically could not put more tartar on this cat's tooth. He doesn't even have gingivitis. So I want you to take it out of your lexicon. Tartar doesn't matter. It's a sign of gum disease, but it's not the cause, and it doesn't correlate exactly. It doesn't even correlate close, in my opinion. I can't tell you how many animals I see like this, and I can't tell you how many animals I see with perfectly clean teeth that I rip out half of them. So bottom line is that you've got to get these pets under, and you've got to clean their teeth. So you get this question all the time. Well, I've had animals all my life, and I've never had gum disease. Why are we seeing it now? Well, several reasons. Number one, our pets are living forever now. I mean, back when I was first starting into looking at vet school in the mid-'80s, if we got a dog out till 8, that was great, right? An 8-year-old cat was old. And oh, by the way, 8 years old is still considered a senior. That's pathetic. Nowadays, I routinely do animals, 18, 19, 20. If I'm not doing an 18, 19, 20-year-old animal every week, I'm surprised. My record for anesthesia is a 26-year-old cat. 26, yeah. And a 23-year-old dog. My anesthesiologist record is a 31-year-old cat. These animals are living forever now. I tell people all the time, 20 is the new 10. It is. And these animals are living. Small dogs, 18, 19, 20, not unusual. Speaking of small dogs, we've had, speaking of small dogs, that's Sage, increased ownership of small dogs. What kind of dogs did we see in 1985? We saw Labradors. We saw Rottweilers. We saw Shepherds. Man, we saw dogs, right? Well, now do we see? What do we treat all the time? Yorkies, and poodles and Maltese, and we keep breeding them smaller and smaller and smaller. I treated a 0.7 kilogram poodle the other week. That's not a dog. It's a hamster. And because we bred them down, we shrunk their teeth, or their jaws more than we shrunk their teeth. So they're crowded, they have short roots, they're not orally active, they don't like their teeth being brushed. There's all these, they live forever. So that's why little dogs get worse disease. But the big thing is they're genetically prone. It is. It's hereditary in humans, and it's hereditary in animals as well. Purebred dogs and cats get worse disease, and commercial pet foods have decreased the need to chew and increased the retention of plaque and calculus. Case in point, 12-year-old Labrador Retriever at 12,000 feet. That's my dog Kaylee. She passed away a few years ago at 16. So these animals are living forever nowadays. So treat their teeth. So what does periodontal disease do? Well, the first thing it causes is gingivitis. Gingivitis is inflammation only to the gingiva. So we don't have any bone loss yet. There's no pockets yet. But what do we see? Well, redness and swelling of the gums, plaque and calculus on the teeth, increased bleeding on probing, and bad breath. Let's take a look at that. Redness, swelling, bleeding, bad smell. What is that a sign of? If you saw skin that was red, inflamed, bleedy, smelly, what would you call that? Pyoderma. It's an infection. This dog is infected. This dog is dying a little bit every day because of his gum disease. I'll get to that in a minute. But the problem is the vast majority of veterinary professionals would go, it's not that bad. Let's wait till February. We're having a special, right? No, this dog needs to be treated today. He's sick today. Don't wait for it. Or let's wait. It's not bad enough yet. Yeah, it is. This dog's feeling it. He's infected. It needs to be treated. Here's the example Dr. McLeod and I came up with. This dog's going to cut paw pad. He cut it at the beach on a piece of glass. Is he dying from this? No. He might be bleeding some blood. He might be limping a little bit. Actually, probably not too much. Dogs are pretty tough. If you saw this dog in your practice, would you go, you know what? August is our last rated paw month. Why don't you come back then? Or you know what? Let's wait until he needs a lump removed or some other reason to go under anesthesia. Would you do that? No, you would never do that. Why? Because if you know if you don't treat this today, it's going to do what? Get worse, right? And then you might end up with something like this. And now you've got to amputate those legs just because you didn't treat that. I'm telling you, the veterinary medical board would not be happy if they got a complaint. Okay? Oh, Brooke, you're so egocentric about dentistry. How can you relate this to this? How can you relate this to an extraction? Let's think about it. Because if you don't treat this, what's going to happen? It's going to get worse, right? And the infection is going to get worse, and then you're going to have to extract the tooth. Oh, but it's just a tooth, right? If you think about it, what's a dog's hands? What does a dog use for their hands? Their mouth. And if their mouth is their hands, then what are their fingers? Their teeth. Specifically their canines and their incisors. So when you extract a tooth out of a dog, you are essentially amputating a finger. And oh, by the way, dogs have 4 fingers in one hand. Please get into treating these animals earlier. So here's another thing you were taught about gum disease, which is wrong. Redness is the first sign of gum disease. No, it's not. I've had veterinary dentists review articles that I've written and said, well, the first sign of gingivitis is redness of the gums. No. There's a study in 1973 in the human literature. The first sign of gingivitis is not redness of the gums. It's bleeding upon probing or brushing. You guys ever floss your teeth and spit blood into the sink? You have gingivitis. You do. So here's the problem. This dog comes into your clinic. Teeth look pretty good, right? He doesn't need a cleaning, does he? Until you touch it. That's just probing right here. And it's spreading everywhere. All this blood along here. This is horribly infected. That's this dog right here. So like our pink hippo here, he looks healthy, but he's not. He's got inflammation. So this is why, going back here, this is why the studies from the 1980s are wrong. Number one, it was based on a 1980s model of big dog. Number two, it was based on redness of the gums being the first sign of gingivitis. It's not. Current studies using periodontal diagnostic tests, using bleeding upon probing, 90% of dogs at 1 year of age have gum disease. 90%. And you cannot diagnose early signs, early gum disease without anesthesia. You can't. Absolutely can't. So the problem is the vast majority of veterinarians are taught, we first dentistry at what, 4, right? And that's what I hear all the time. Oh, your dog's only 2, he's too young for dentistry. Your dog's 3, he's too young for dentistry. Oh, your dog's 4? Yeah, probably about right time to do the first dentistry. If you have a Labrador, yeah, 4 might be okay. But if you have a Yorkie, it's 3 years too late. How do I know that? Several years ago, I had a 18-month-old pug, year and a half, 18-month-old pug, came in because he had recession on the P2, P3s because they were crowded. 18 extractions at 18 months of age. Better than that, I had a Yorkie come in, 4-year-old Yorkie came in because he was sneezing. He had been at his regular vet, and they said, oh, he's only 3, he's too young for dentistry. They did a periodontal diagnostic test called an aura strip, and they came up really high, so they came to see me because the mouth looked good because the owner was brushing. 4 years old, first dentistry in a Yorkie. How many teeth did he leave with? None. Right. I'm sure you were out there going, oh, 2, 4? None. Full mouth extraction. I'm sure some of you said full mouth extractions. And I'll bet you very few of you were surprised when I said full mouth extractions in a 4-year-old Yorkie. Here's the sad thing. I give this lecture, well, pre-COVID, I gave this lecture about 100 times a year. Average 50 people in a room. So that's 5,000 people a year for, let's say, 5 years. So that's 25,000 people I've lectured to. Nobody was surprised. Nobody that full mouth extractions at 4 years of age. Yet when I ask those people, oh, so then do you recommend dentistry younger? Oh, no. Well, why not? Because clients don't want to hear it. Well, I don't want to hear that I got to lose 20 pounds or quit drinking so much or stop smoking or whatever. But it's your job to educate. So here you go. We'll help you out. I'm writing a book. It'll be published January or February 2020 on little dog dentistry and why it's important to clean their teeth early. But we want to help now. The WSAVA dental guidelines, if you go to wasava.org, you can look up the dental guidelines. We are recommending the first dentistry of all dogs under 10 pounds be done before a year of age, 9 to 12 months of age, with full mouth x-rays. Oh, by the way, the AHA dental guidelines, which just came out in 2019, all dogs under 20 pounds should have their first dentistry before a year of age with full mouth x-rays. Large dogs and cats, they say 2 years of age. We can't wait. We've got to get ahead of the curve and start treating these patients early. So if you didn't treat the gingivitis, what's going to happen in susceptible patients, small breed dogs especially, greyhounds and Cavalier King Charles Spaniels, is that now you're going to get inflammation to the deeper supporting structures of the teeth. Now you're going to get into bone loss. And it's either going to be via gingival recession, which you can see, or more insidiously periodontal pocket formation. This is irreversible. Once the bone is gone, it's gone. It's never coming back without advanced regenerative therapy, which we'll talk about, I think, in the next lecture. I tell people this every day. Periodontal disease is 100% preventable. 100%. Brush your dog's teeth every day, clean the teeth every 6 months, you're not getting gum disease. 99%. But it's 0% reversible. Prevention, 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 prevention. So now we got a little bit of recession here, a little early furcation exposure. I mean, we could probably clean these teeth. We got like a 5 or 6 millimeter pocket here. Make sure you get the tartar out there, but we can fix these. It's a little more difficult to do, and they're more prone to gum disease down the line, but we can fix this. But here's the problem. This isn't where my patients come see me. This is my life. I do this almost every day because we haven't done a good enough job educating our clients as to the importance of dental care early. So now I got to go down to the store and get some crackers for the cheese pouring out of this dog's face. These teeth are all infected, all loose, and I call them piano key teeth because they're literally, you can pluck them out. I also call them the pluckables because that's where the bone's supposed to be, and that's where the bone is. This dog had horrific infection. And Mrs. Jones, the owner, is going to go, well, it's so unfair that Fifi needs to lose her teeth. No, it's unfair that Fifi has been suffering with infection for years. Okay, so we've got to do a better job. Now, unfortunately, most of our clients' opinion of gum disease is bad breath and tooth loss, right? Worst thing that's going to happen is going to lose teeth. Wrong! Especially in little dogs. Little dogs get way more local effects than big dogs do. Oronasal fistulas are the most common. Class 2 periwindo abscess, I'll show you. Eye problems. This can happen in big dogs too, but it's more common in little dogs. Jaw fractures, seeing it more and more in small breed dogs. Increased incidence of oral cancer and infected bone osteomyelitis. I will tell you that, I'm going to be in all honesty, all veterinary dentists believe in everything but oral cancer. There are no veterinary studies that show that there's an increased risk of oral cancer. There sure as heck is on the human side. There is proof. I mean, everybody believes these, not necessarily that one. I do, and I'll explain why. As far as the systemic effects, which I'll get to, not all veterinary dentists believe in that, but there's no cause and effect, but there's so much anecdotal evidence. I'll talk about that when I get there. So an oronasal fistula is when the infection eats up the inside surface of the upper canine and creates inflammation to the palatine surface of this upper canine. You can see how beautiful the rest of the teeth are, and he's got a fistula going all the way into the nose. The tooth is solid, so you've got to get these patients down and probe them. This is what happens after the tooth has been extracted and it doesn't heal correctly. You can see the scarring here from the flap that was attempted. If you guys are having problems with oronasal fistulas, two things. You get two chances. To take out the tooth, try and close it. If it doesn't work, make a flap, try and close it. If it doesn't work, refer it. Every time it's cut, it scars and it's more difficult to close. Number two, if you are having problems, come take a class. We teach this in our advanced extractions course. If you're not there, we'll teach you how to close this in the extractions course. Okay. So you have to make a flap. We'll teach you how to do it. It's called fenestrating the periosteum. Make sure there's no tension, and it'll heal. But I talked about periodontal flap surgery. When you have these deep pockets, we'll talk about when you can and cannot treat them. This is a great indication for guided tissue regeneration. And again, GPs out there that are into dentistry, you can learn how to do this. Ocular damage. The tooth roots of the upper fourth premolar and upper molars are right below the eyeball, especially in brachycephalic and small breed dogs. Chronic inflammation can be vision threatening. This dog's not here to see me. This dog is here to see the ophthalmologist. Why? This isn't an abscess. This is vitreous humor pouring out of this dog's eye. This dog's eye, like our little friend over here that got bad gum disease, his eye popped. You don't think that hurt? Why did this dog's eye pop? Well, here's the zygomatic arch. Here's the infected tooth. The infection came down here, got in through what used to be the blood supply, killed the tooth, and created an infection over here. This dog lost his eye because of gum disease. Now, it's always funny until someone loses an eye. Periodontal disease is no laughing matter. Okay? A class 2 periwindo abscess is where the infection is just like an infected tooth from a fracture. But what happens, and again, you can see how pretty happy and healthy these gums are. It's not bad. But look where this probe's sitting. The infection, this is a big pus pocket here. You can't really see that. You can see inflammation, but you can't see how bad this infection is in this area. So the infection got all the way in through what used to be the blood supply, killed the tooth, came up over here, and is creating periapical abscessation on these other teeth, or periapical infection here. So here's the one that we see more often. Okay, this is a very common thing to see in small breed dogs, especially Shih Tzus and Lhasas. I don't know why. So this is a patient I saw in our Las Vegas practice. The infection came down here, killed the tooth, caused marked weakening of the bone. The jaw's not fractured yet, but that's a fibrous unit. It wants to fracture. So the infection got in, killed the tooth from the blood supply, came up through the common pulp chamber, and is causing severe periapical lucency here. If I saw this tooth and I was in your seats, I'd refer this dog so fast it would make your head spin. I would not want to touch this. I tell people this all the time. If I had the opportunity to refer this dog, I'd have referred this dog. But I didn't. I had to treat it. So how did I treat it? Well, you could try and sneak this tooth out without breaking the jaw. But what I prefer to do is to cut the tooth in half. The back half falls out, right? There's nothing holding it in. And the only thing holding the jaw together up here is the tooth. So we did a root canal on the front half. So you see we took out the back half. That's going to heal in. And we did a root canal on the front half. This is 6-month recheck. Look at how all that bone grew back. This saved the tooth. I mean, I had planned eventually of taking this tooth out, but the root canal worked so well that I'm like, well, you can live with half the tooth now because it's periodontally healthy. Don't let anybody tell you that you can't root canal a tooth that's got periapical lucency. You absolutely can. They'll do okay most of the time. So that's how we treat it as veterinary dentists, and that's why I would recommend you send them away. Speaking of that weakened bone, pathologic fractures. Again, we didn't used to see these because we had big dogs, but little dogs are much more prone to it because their teeth are proportionally larger. So this dog's 14, never had his teeth cleaned because the client was afraid of anesthesia. We got him under anesthesia and we took an x-ray. Here it is. That is 0.3 millimeters of bone left. You look at this jaw is wrong and it's going to break. And again, if I had the opportunity to refer this dog, I'd refer it because I didn't want to touch it. But I had the x-ray. I told the client, a jaw fracture is possible. You warned them. And if I were in your shoes, I would refer this. And if the client didn't refer and they wanted you to take it out, again, I used a 22 gauge needle and I teased this out. I sectioned it and I used a 22 gauge needle and I teased this out. Oh, by the way, that's the mandibular canal with all the blood vessels and nerves that you get to deal with in there. But be really careful. And the jaw didn't break and he did fine. But again, you've got to take x-rays. This will let you know that this is weak, okay? And then you educate your client. So there's your CYA, okay? If you don't take x-rays, you're going to break the jaw. I would have. Oh, by the way, where this tooth ends in relation to the bottom of the jaw is normal in dogs under 10 pounds. Like I said, lower first molar are proportionally larger. If this was a Labrador, that jaw would end, that bone would end halfway, or tooth would end halfway down. You're not breaking the jaw of a large breed dog taking out a lower first molar. You're not, unless it's severe cancer. But if you've got to take out the lower first molar of a dog under 10 pounds, be afraid. And if you have to take out the lower first molar of a dog under 5 pounds, be very afraid because there's nothing left, even without bone loss. Okay. Same thing with lower canines, especially in dachshunds. I hear it all the time that these guys are getting their jaws broken. Dachshunds are the number one. Cats happen too. So again, that's 1/10 of a millimeter of bone with all this bone loss. You got to be careful. Again, recommending referral is a good idea. And this is what a pathologic fracture looks like. So you can see all this bone loss on the backside. This was due to a dog fight. So dog fights aren't going to break normal jaws. Falling down the stairs or off a couch is not going to break normal jaws. So this is the periapical lucency here. So in a pathologic fracture, the bone gets weaker, and then it breaks. Okay. Oh, by the way, in my opinion, dentists do a much better job with jaw fractures than surgeons do. These are two cases that came from surgeons. This is a plate. This is a KE. You can see how the screws are going right through the roots there, right through the tooth there. Why didn't these teeth heal or these jaws heal? Because they have infected teeth. It is not going to heal until the infected roots come out. That's why I think that us dentists do a better job than surgeons at jaw fractures. I think surgeons do a good job at ectomies and stuff, but we do a better job in my opinion. Once the tooth has come out, we can fix it either by an acrylic splint or a wire. Oral cancer, like I said, no proof to this, but periodontal disease is linked to an increased risk of oral cancer in humans. Why? Inflammation. Chronic inflammation will induce cancerous change, just like smoking and lung cancer, chronic exposure to the sun and skin cancer, and chewing tobacco and lip and cheek cancer. So it is shown, and it makes perfect sense, but there's no studies. And then finally, osteomyelitis. Osteomyelitis is dead infected bone. You can see the periosseous reaction here. This entire hemimandible is dead and necrotic and infected. This is what it looks like. That's not tartar, that's the bone. Why? Chronic inflammation. Periodontal disease is the number one cause of osteomyelitis in human dentistry. Horrible infection. This dog lost its whole hemimandible. Why? Gum disease. So when it comes to talking to your clients about gum disease and convincing them to get their dogs treated, don't just talk to them about bad breath and tooth loss. Talk to them about jaw fractures, eye loss, nasal infections, osteomyelitis, maybe cancer. But now let's talk about the big guns. The big problems is the systemic effects. And again, limited, no cause and effect, limited veterinary studies so far. They're coming out all the time, and I'll talk to you about the difference. But there's numerous studies, thousands I would say by now, or at least hundreds, showing a link between periodontal disease and systemic ramifications, because the inflammation, the red gums, are the capillaries becoming leaky to allow the gamma globulins and white cells into the bloodstream to fight off the infection. Unfortunately, that allows the bacteria and their byproducts into the bloodstream. So a couple important things. Number one, looking at the bottom, we'll start with that. Everyone talks about the yuck mouth, the pus mouth causing systemic infection. Just gingivitis is enough. Now, again, the worse the infection, the more the surface area, the bigger the amount of infection going through the bloodstream. but it's just gingivitis is enough to cause it. But the big thing is, and this is where everyone kind of is like freaked out, the bacteremia that is induced by eating dinner or brushing your teeth, flossing your teeth, using a toothpick is the same amount of bacteremia induced by cleaning the teeth or an extraction, which is why veterinary dentists don't use antibiotics anymore. We don't, hardly ever. In healthy patients, the answer is no, I don't. I don't care how bad that mouth is. Now, some veterinary dentists will use it to decrease the amount of inflammation. During the procedure, if they give some pre-op, maybe. I don't buy it. I never, and I say never is a strong word, I never pre-treat, ever. I will use intraoperative antibiotics, ampicillin usually, but ticarcillin's fine, as long as it's on board during the cleaning. If I've got an animal that's got a comorbidity, and that means a heart murmur, a recent implant, especially an ocular implant, I guess they could really get infected. Significant kidney disease, not a creatinine of 3, no, not giving it. Diabetes is a good one to use it in. Severe liver disease, severe kidney disease, FELV, FIV, those would be dogs on chronic steroids. I would consider giving one shot intraoperatively, but then I would not send it home. I don't, because you removed all the infection and the bacteremia is cleared within 15 minutes. So there's no need to send home anything. Intraoperative for comorbidities and significant disease. And again, we see this more, we see these systemic effects more in small breed dogs because they have a larger surface area, and that's going to cause worse infection. So please treat these animals. What does it do? Well, and again, this is my opinion because you have a larger surface area in small breed dogs compared to the size of their body than people. So they're going to get more bacteria going through their bloodstream for their size. So what does it cause? Well, valvular endocarditis. Not everyone believes the study. I do. There's a 6-fold higher risk of dogs with stage 3 periodontal disease of having valvular endocarditis. Why? Because of the chronic bacteremia happening every day. Now, some people question the study because small dogs tend to have more murmurs, and so therefore that needs to be first, but I still believe that it plays a role. And so there are no studies that show a link between periodontal disease and periodontal therapy, extractions, cleaning, and developing endocarditis, but there is a study that shows there's a link if you don't, okay? Heart function. Lots of human studies. There's actually a study in dogs now that if you have bad gum disease, you have worse heart disease. There is, okay? So you definitely need to be taking care of your animals. And oh, by the way, we'll talk about this in a minute. A murmur does not mean your dog can't have anesthesia. A murmur actually means your dog needs anesthesia for a dentistry. What else is it caused? And again, on the human and veterinary side. Okay, so there's where you get studies on the human side and the veterinary side. Kidney, dog and cat and human. Hepatic, dog and human. Increased inflammatory markers, dog and human. Studies that show that an increased periodontal disease worsens all of these things. Okay. On the human side, arthritis has been shown to be increased with gum disease. Diabetes mellitus is a huge one. Insulin resistance in people with periodontal disease is massive. Pulmonary disease and people with bad periodontal disease die earlier than people in good periodontal health. They do. There's a study out of I believe it's Sweden, is somewhere in Scandinavia. People that have bad gum disease have a higher risk factor for early death than smoking. If you think smoking is good for you, keep going. But I'm telling you, you can't go down to a grocery store or any liquor store and buy cigarettes without reading all the smoking kills, causes cancer. I'm telling you what, these dogs need to be, these small dogs need to be tattooed on their forehead. Periodontal disease kills. Please take care of my teeth. Speaking of anesthesia and taking care of these animals' teeth, if you have a dog that's got heart, lung, liver, kidney disease, or diabetes, and you treat their nasty mouth, their kidney function improves. At least on the human side they do. Liver function improves. Heart function improves. Diabetic studies. These are all human studies, although we are working on a renal study that shows that they improve. Okay? I know they do. So no pet is too old for anesthesia. Okay? If you've got a pet it's older or it's got comorbidities, treat them. Because if you don't treat these animals that have heart, lung, liver, kidney disease, what's going to happen? They're going to get worse, right? Heart, lung, liver, kidney is going to get worse. And then their dentistry is going to get worse. So what happens to me as a specialist is somebody ignores the systemic, or the dentistry because of the systemic disease, and then they end up with a disaster mouth in a dog that's really sick. Here's my big thing. When an animal gets a little bit sick, don't stop treating the teeth. That way, when they get really sick, you don't have to treat the teeth. Here's the thing. With cardiac disease, a murmur does not mean that these patients can't have anesthesia. They absolutely can. Work them up, get a cardiac echo. But I'm telling you, there was a study out of North Carolina. Dogs with heart disease were not at increased risk over dogs that didn't. Not. Now, again, those were done by anesthesiologists. They were well worked up. But again, if I'm not doing a dog with a heart murmur weekly or twice a week, I'm surprised. They do great. They really, really do. Oh, going the wrong way. So again, speaking of geriatric, no patient is too old for anesthesia. Age is not a disease. It's a natural consequence of not dying. Don't die, you get older. Just because they're older does not mean they have heart, lung, liver, kidney disease. It means it's more likely that they have it, but it doesn't give it to them. Oh, by the way, minor diseases isn't a problem either. But work these animals up. Please do a complete blood panel, especially in older patients at T4. Don't forget the urinalysis. Urinalysis is liquid gold. It really is. ECG, we have started to do in our practice CardioPET, which is, it's a telemetry read by a cardiology service through IDEX. We run them on every patient. It's a good way if you run them all the time to make some money, but we found some pretty significant stuff on these patients. And so we have animals that have lived through anesthesia that probably wouldn't have, and we didn't hear it. Honestly, we're pretty good. I do like chest x-rays on my older pets as well. If you've got a pet that has, comorbidities and you're not comfortable with the anesthesia, refer it. Us dentists are far more comfortable with anesthesia because that's all we do. And we usually are faster and we have access to other specialists, whether it's a criticalist or an anesthesiologist. We work with an anesthesiologist all the time. So once the baseline health is established, we can determine the risk-benefit ratio. And most of the time, it's going to be on the side of doing the teeth. Trust me, they do really, really well. So talk about the advantages of oral care. Talk about the negatives of not doing proper oral care. And if you don't have time to talk about this to your clients, if you don't want to spend 20 minutes discussing everything, send them to our website, Dog Beach Vet. I've got client educational videos, the exact presentation I just gave you, pictures, x-rays, all that kind of stuff, talking about periodontal disease and what it's doing to your pets. So send your clients there if you don't want to have that conversation. So in conclusion, periodontal disease is by far the number one problem in small animal patients. It has numerous severe local and systemic effects. It's called the silent killer. Proper therapy improves patient health and practice income. Proper therapy of periodontal disease, as well as other oral and maxillofacial pathology, increases their overall health. It increases their quality of life, and it may just increase their quantity of life. All pets have the right to a pain and infection-free oral cavity. And undertreated dental disease is now considered by the World Small Animal Veterinary Association as an animal welfare concern. So this is our WSAVA group. It's 100 pages. It was printed, put together by JSAP. It's a beautiful 100-page book, basically, of the latest and greatest. Check it out on wasava.org. So go forth and take care of these animals' teeth, and please, prevention. Signing off from San Diego.